So welcome to week 10 of Health Promotion Planning and Evaluation. So rather than a face-to-face lecture for week 10, I thought I would actually do a recording on the key points in relation to program implementation, which is this week's topic. Your workshops this week will run as per usual, and Kate and myself will be working with you to really nut out your program aims and objectives. And if you've already done that, it might be that we assist you with thinking about your strategies as well as your evaluation plans. We really want you to be using the program logic template that we showed you in week 8, but also using the template that we've provided for assessment 3. So this recording will cover some key points which will help you with assessment 3 with your program plans, but also some key things to think about when in practice. And for some of you next semester, you'll be required to do program implementation as part of your field placement subject. So I'm going to touch on today what is implementation. We're going to look at the 5 phases of implementation, and then I'll talk about some of the safety and ethical issues or concerns that are often associated with implementation as well. I just want to draw your attention back to the program planning and evaluation diagram that Glenda showed you earlier on in the semester. So far in this subject, we've done the community assessment, and you've been out and you've collected primary and secondary data now. We have thought about evaluation. So last 2 weeks we've looked at evaluation. We've had you thinking about program development in terms of writing aims and objectives, and thinking about strategies and using that program logic to do that. And so I just wanted to remind you that, you know, this is an iterative process or a cycle. And so you really need to be thinking about designing, implementing and evaluating all at the same time. But for today, what we are going to look at is the program implementation. So program implementation is about setting up, managing and executing your project. It's about implementing evidence from research into policy and then into practice. There's a couple of steps that we go through or that need to happen in terms of moving a project from planning to implementation. And also that, you know, program implementation and project management requires some certain skills. So we'll touch on some of that in this recording as well as in the workshops this week. So as I said, there's 5 phases for implementation. And so I'm just going to talk briefly about each of these. So the first one is first phase of program implementation is the actual adoption of the program. So at the adoption of the program phase, you need to ensure that your program is appropriate to the health issue or the need that's been identified. You need to check that your program fits with things like government priority areas, so where governments are directing funding. You need to make sure that the program fits within your organisation's strategic priorities. It may be that your organisation has state government funding under the prevention framework or integrated health promotion framework, and may have a health promotion plan for 3 or 4 years. And so you might need to check that your program actually fits within that particular plan as well. But also that your program is appropriate to the community needs. So going back you know, to your needs assessment, and also the literature as well. You also need to ensure that your program is appropriate to the target group. So again, you know, it's referring back to your community needs assessment, and again, also looking at that literature on program effectiveness for the target group that you're looking at. And then you need to ensure that the program is doable within the resources available, both monetary resources as well as the human resources. And finally, you need to ensure that this program has the best chance of bringing about a desired change. So that's making sure that your program is evidence informed. Okay. So the second step in program implementation is identifying and prioritising tasks. And this is really imperative to ensure that you've got smooth implementation. You need to think about the tasks and the timelines. You need to think about your resources, thinking about who will do what and when, and what do they actually need to be doing. We will ask you to think about those things in relation to your programs in Assessment 3. there should be enough detail in a program plan for someone else to be able to duplicate or replicate your program. And so, for example, it might be that, you got sick and had to go on extended sick leave. Would someone know what needs to be done and when and how it's to be done? So program plans need to be as detailed as possible. There are a couple of planning tools that you can use to, identify tasks and think about the timelines and the resources. And one of those is what's called a Gantt chart. So a Gantt chart is essentially like a calendar that enables you to map out all of the tasks that need to be completed over the course of your project. It allows you to have multiple tasks happening at the same time. And it can also include details on who is responsible for what tasks. You can design a Gantt chart for short-term and long-term projects. They can be organised by weeks or months or perhaps even across years. This example here is an example of a Gantt chart for a project where tasks are set out month by month over the course of a year. And this is year one, so this might have been a program that went for maybe 2 or 3 years. So looking at this particular example, they've allowed 2 months for developing the program rationale. They've allowed 1 month to conduct the needs assessment, another month developing the goals and objectives. And you can see that sort of linear process of tasks, that one thing, might need to happen before another, or that multiple tasks might be happening at the same time. Okay, so you can also use the Gantt chart as a basis for monitoring evaluation. And so Kate talked in week 8 about monitoring evaluation. And this is, one way that you can actually do that and track that your program is on track and is happening as per that program logic template that we've showed you in week 8. And it also allows you to look at that, and ask the question, are you achieving predetermined milestones? Otherwise, what happens is that time just evaporates and you actually lose track of what you've done and perhaps what still needs to be done and who's responsible for what as well. Another planning tool is called a PERT, or Program Evaluation and Review Technique. So PERT can be used for quite large-scale, complex programs. It's more often used in business than health promotion, but there's no reason why it can't be used in health promotion, and some organisations may actually be using this as their preferred tool. So the PERT has 2 components. There's the diagrammatic component. So as you can see, there's a visual representation here of the relationship between tasks and the order in which tasks have to happen. The tasks are numbered in the order that they need to be completed. So lower numbers are the tasks that need to be completed before the larger number tasks. The other component is the timetabling component. So it includes 3 estimates of time for each task. So the optimistic, the pessimistic, and the probabilistic. So in other words, the maximum, the minimum, and then the reality. So for example, optimistically, we might conduct our needs assessment in 4 weeks. Pessimistically, it might take us sort of 10 weeks. And then the probabilistic, or the reality, is that it's probably, it will take 6 weeks. So essentially, you estimate the shortest possible time around each task, the most probable amount of time, and the longest amount of time, particularly if things don't go as planned. The PERT is usually calculated backwards from a fixed end date, and it enables you to see that relationship between the tasks, which is something that Gantt charts don't necessarily always capture. So if you look at this particular example, you can see that certain things need to happen before the other tasks, or that certain tasks have to happen together. So for example, task 4 in this case needs to happen before task 10, and task 10 happens at the same time as task 8. This is a really good planning tool to map out just what needs to be done and how those tasks actually relate to one another. The third phase in program implementation is establishing a system of management. So once the tasks have been identified and you've got your timetable completed, you need to consider how the project's actually going to be managed. So we're talking about efficient and satisfactory management, which is vital to long-term success of programs. So really that's just about, is the program able to be delivered on time, on budget, and according to the plan? You need to look at your human, financial and technical resources, and depending on the size and the type of the program, management could be one single worker, or it could be a team, and each person in that management team is responsible for different components. A one-off intervention will be managed differently to a 10-week program. A 10-week program will be managed differently from a program that's running perhaps over 2 or 3 years. So you need to think about how are you going to monitor the program resources. And again, Kate talked about monitoring evaluation in week 8. You might want to just go back and revisit that lecture. Part of managing a program is being, as I said, being responsible for the budget, the human resources, but also being responsible for your participants, being responsible for the evaluation, and just overseeing the day-to-day activities. You have to be responsible for budgets. No management likes a blowout in the budget, but the human resources also need to be managed quite carefully. You want workers to be happy and healthy, and if they're not, then as program managers, you need to be looking at why. And then also your participants. So it's making sure that your participants are happy and okay, and participating as you would expect. And if they're not, again, it's your responsibility as a manager to actually look at why is that the case. We are looking at funding and budgets in more detail next week, but just quickly in terms of budgets, what we're talking about is a formal statement of the estimated revenues and expenditures for a program. It is an essential part of the planning process, and your budgets are usually written before the program even gets funding. And that's because funding bodies will want to see upfront what are the costs associated with this particular program, and where are you generating revenue from. So maybe part of the revenue is coming from that particular funding source, part of it may be that your organisation is putting in funding, or there may be other funding bodies involved. So stakeholders want to see that. You create budgets for the entire length of the program. If you've got a program that's perhaps running over 2 or 3 years, you would have budgets for each year of the program. Or if it's different phases, perhaps different interventions, again, you might have budgets for each stage of the particular program. You also need to work your budget into the organisation's budget as well. So for any particular financial year, so a lot of organisations, will have, their overarching budgets, but within those will have their program budgets as well. It's generally, budgets are generally the responsibility of those who are planning the program and all the key stakeholders. In some organisations, the person responsible for the budgets may be someone like a financial officer. Budgets often require justification for expenses. So, for example, maybe your program requires you to do some travelling, and so that travel would need to be broken down, for example, into perhaps the number of trips that you're planning, how many kilometres each trip is, the cost of the fuel per kilometre. Or there may be stationery costs or photocopying costs, and so, for example, that might be broken down into the anticipated number of copies you need to make and how much each, the cost is per copy. If you've got staffing, for example, that might get broken down into what's their hourly rate and how many hours are you expecting that they will work, plus any on-costs that are associated with employing new staff. So, budgets do need to be quite specific. We will expect you to have just a simple budget for your program, but with some justification of the expenses. And as I said, we'll talk a little bit more about that in week 11. The next step in implementation is actually putting plans into action. So there are 3 main ways. There's piloting, there's phasing in, and there's total program implementation. Often stakeholders or funding bodies or funding models stipulates how a program is implemented or what phases are implemented, whether it's a pilot or phasing in. Or you might actually say in your funding application that you would like to do a pilot or a phase-in approach to your program. So total implementation is not always ideal, and it's not always possible. Ideally we should be aiming for piloting or phasing in except perhaps with, a one-off intervention, for example, maybe a public education session. But again, there might be aspects of that you could actually pilot in terms of testing content, etc. So piloting is ideal, but again, not always possible due to perhaps time or resources. It is important to try and identify any problems with a program that might exist. And so pilot testing allows planners to work out any bugs before the program is offered to a larger segment of the population, and can be used to validate the work that has been completed to date. Piloting should be conducted in a similar setting and with people like those who will actually eventually be using the program. And so if you use a different group, you may actually fail to identify any problems or concerns that would be specific to your population group. As part of piloting, you should be checking for things like that the strategies were implemented as planned, that the strategies worked as you had intended, that you've got the adequate resources available in terms of money, time, staff, etc. And that participants of the pilot had an opportunity to evaluate aspects such as the content, the approaches used, the effectiveness of the facilitators, space, resources, etc. And this feedback, gives you as planners insight into how to revise the program. And if there are any, if there are many changes to be made, then you might actually need to repilot before you actually move ahead to phasing in or total implementation. So phasing in, of a program is a really useful approach for really quite large programs where you might have multiple strategies or multiple interventions, as it gives planners more control over the program, and it can also prevent planners from getting in over their heads, essentially. So there's several ways that you can phase in. You can phase in by different program offerings. So for example, a program that's looking at workplace health might start with a stress management program. That might be followed by some sort of smoking cessation program, which may then be followed by a physical activity program. You can phase in by a limit on the number of participants. So again, with a workplace program, you might start with one department followed by another and another. You can phase in by choice of location. So maybe your program is to be rolled out over quite a large geographical area, and you might phase that in by community. Or again, if the workplace health program, it might be from you might phase it in with one organisation followed by another organisation. And then finally, you can phase in by participant ability. So, if it's a physical activity program, you might phase it in, with beginners first, and then move into the more intermediate followed by advanced abilities. So total implementation, as I said, is implementing the program all at once. And in most situations, in a lot of situations, this can actually be a mistake and is not doable, because planners should really be working towards total implementation through piloting and the phasing in processes. As I said, the only exception would be if the program was sort of a one-off, like a single lecture, possibly screening. But even then, in those sort of situations, piloting can help with testing out some of your resources. So the last stage of implementation is the ending or the sustaining of a program. And so while this might be, thinking about sustaining a program might be the last phase, you might actually ask the question early on, does this program need to be sustained? And if so, how will that happen? So that you can actually plan for that while you're planning the rest of your program. When we're talking about sustaining a program, nearly 50% of all programs don't last more than a few years after the funding has ceased. And so if you've only got a limited amount of funding for a certain amount of time, you might need to think about how do you keep this program going once that, that's ended. Sustaining a program may be needed if the goals and the objectives have not been met within the specified time frame. If your program is a one-off program, then of course it's a one-off program, and you don't need to really think about sustaining it. So whether a program needs to be sustained can really depend on just the type of program. In this subject, we've been getting you to think about community development approaches, and so, you know, we should be looking at whether the community can take over the program or even just aspects of the program. So looking at how engaged are the community with the program, or how are you engaging the community with the program. So your plan might be that you as the worker may not always be needed, that if you've created the right environment, that you've got an empowering environment, that you've worked with the community to build their capacity, then the community may actually be able to manage this program and you can actually withdraw from it. Some of the approaches that you can use to think about sustaining a program include things like advocating for the program to continue, either with your organisation, with funding bodies, or perhaps other key stakeholders. You might think about partnerships. Can you partner with other organisations with similar missions to share the resources and the responsibilities, and revisiting or revising the rationale for the program so that you can keep it going? Or it could be with a community development approach, looking to get the community itself to take over that program, and what capacity do they need in order to be able to do that. And then, as I said, you can plan for sustainability from the very outset. So you need to think about how the program will be sustained during the planning process. Some of the concerns associated with implementation are around the issue of safety. So our ultimate goal of health promotion is to improve health, and certainly in no way do we want to put people in danger or worsen their health. And therefore we need to give attention to the safety and maybe even medical concerns associated with programs. To ensure safety, we need to inform participants about the program they are considering joining. We need to provide participants with the necessary information before they make the decision to join, and that actually enables them to then provide us with informed consent. So you need to explain, be able to explain the nature and the purpose of your program. You need to inform program participants of any inherent risks or dangers associated with participating, any potential discomfort they may experience as a result of participating. You also need to explain the expected benefits so that people can weigh up risk versus benefit. You need to inform participants of alternative programs or procedures that will accomplish perhaps the same thing as your program, and indicate to participants that they are actually free to discontinue at any time as well, without prejudice. We've talked a lot about ethics already in this subject, but we just need to remember in implementation the dignity and the autonomy of participants, that some participants may have diminished autonomy, such as children or people with disabilities, and so just revisiting those three fundamental ethical principles of respect for person, beneficence, that idea of doing no harm, which requires planners to protect participants by maximising those benefits and minimising the harms, but also using evidence to inform the development of our programs as well. And then, of course, justice. So this requires planners to treat participants fairly. So, for example, things like cost. For example, the cost of a program may exclude some people, such as low socioeconomic groups, from actually participating. But, in terms of justice, there may be issues of sexism or racism or other cultural biases that may actually, exclude certain people from participating. So we want to make sure that our programs don't actually reinforce stereotypes as well. And then there are some legal issues. So you need to be aware of legal liabilities. So things like working with children checks, making sure that you or, people who are implementing programs have police checks if necessary. Organisations will have thought about the legal issues for you, but you do need to be aware of them. Some other, how do you reduce risks of liability? Things like, selecting certified instructors who can lead classes or supervise the use of equipment. So, for example, if you're running a physical activity program, are these being implemented by appropriately qualified staff? If you're doing screening, is this being conducted by people with the appropriate clinical training? You're using good judgment in setting up programs, providing written guidelines for emergency procedures, informing your participants about the risks and the dangers, and making sure that you've got informed consent. Instructing staff to practice within their scope of practice or expertise. For example, if you've got people running programs with non-clinical skills, then they should not be taking clinical assessments. Providing a safe environment by following simple things like building codes and maintenance schedules. And then, of course, things like purchasing adequate liability insurance or public liability. But as I said, your organisations will have, done a lot of this for you. You need to just be aware of, and ask the questions about these. If you have problems and how, you have to think about how you're going to minimise some of these ethical and safety and legal issues, but also thinking about if something does go wrong, how do you then manage that? And you should be anticipating that things will go wrong, and looking at ways that you can mitigate the risks. Record keeping, so you probably will need to keep records about participants' names, addresses, maybe clinical information about people. So you need to remember issues like confidentiality and how are you going to protect people's information. So this often requires policy and procedures in terms of handling and storing information, and that's done within the realms of the Privacy Act. And again, a lot of this will have been thought out by organisations already, but you need to be aware of what their policies and procedures are. And so if you're unsure, you have to ask. But also if you think that their policy and their processes are not up to scratch, then you really need to be raising this with the management of the organisation, regardless of what your position is within that organisation. As I said, you need to anticipate that things will go wrong and having a plan for mitigating or managing risks. And then also, if there are problems, dealing with those in a really constructive manner so that you're getting the best possible satisfaction for all, whether it be your staff and or your participants as well. Sometimes in terms of implementation, things don't work. And so not everything will work all of the time. And this is why evaluation is so important. And if things don't go according to the plan, if your program doesn't get implemented, then you need to be upfront about that. Particularly with your stakeholders, your participants, and perhaps even funding bodies as well, and your organisation. And your evaluation will tell you whether something has worked or not. And so things can, not work for a whole variety of reasons. And again, your evaluation will tell you if perhaps what you implemented wasn't according to the plan, or it was implemented as planned, but perhaps it didn't meet its objectives. And if things, didn't, go according to the plan, hopefully your evaluation will, be able to give you insight into why that was the case. So this is, evaluation is linked to implementation. As I said, lots of organisations have quality assurance systems to monitor programs. This is just one example that comes from the Integrated Health Promotion Toolkit developed by the Department of Health. This really, just gives you some questions to consider as you're implementing your program and in terms of monitoring your program as well. So I'm not going to go through this. You can have a read of these on the notes. There are lots of really good resources on program planning and implementation. I would draw your attention to that first reference, so the McKenzie, Niger and Thackeray. This is quite a good reference in relation to implementation, but it also has some really good stuff in terms of planning and evaluation. So as I mentioned at the start, your workshop will run as usual this week, and I would encourage you all to really use that time to work with your groups to work through the stages of planning and evaluation in regards to your programs. I would encourage you to use the program logic template, maybe go back to that and use that as a basis for thinking about your program, and also using the template that we've provided to write up assessment 3 as well. And you can actually, work directly into that template There's really no reason why you cannot get a large proportion of the program and evaluation plans written in the workshops. Use those 2 hours as a group, to share your ideas, to bounce your ideas, to actually document things like your aims and your objectives and your strategies, and getting, your facilitators to look over these. And so, hopefully over the next sort of 2 or 3 weeks, there's no reason why you couldn't get the large bulk of this assessment written in the workshops, and then just do some polishing out of class as well. So as I said, Kate and I are on hand in the workshops to support you and to bounce ideas off, and we hope that you would do that. So that is all for in terms of the lecture material for this week, and Kate and I look forward to seeing you in your workshops later on.